Hi, my name is Max Whitted, and this is my video presentation of my internship project titled Therapeutic Evaluations for Stroke Patients. So a little bit about my internship. I interned at a Compass Health, which is an inpatient rehab facility. A typical day in the life of my position as an intern was I'd arrive around 7:30 to 8 a.m. I'd familiarize myself with the daily patient schedule. I'd set up and take down equipment and sanitize equipment for therapy sessions. I'd make my rounds to the patient rooms and try to get them ready for their therapy sessions in any way I could. I'd take them down, sometimes bring them back to their room, as well as assisting therapists in exercises. And for this project, therapeutic evaluations for stroke patients, the biggest reason I came up with this project is because strokes are a very common thing that we see at Encompass Health, and evaluations is a very key aspect to the recovery process, and being able to know what exercises do they need to do, how do we get them from point A to point B in the best and safest manner. So that's kind of how I came up with this project. It's something very commonly we see, and I was able to work with one of the physical therapists at Encompass Health and a patient, a new admit who was recovering from a stroke, and we were able to, go through the full evaluation process and go through different treatment plans and different evaluation tests to be able to get her on a track to be able to improve. The biggest thing I learned from this project is that neuroplasticity is key, and it works, and it's something that we need to understand. And neuroplasticity is basically the brain's ability to develop new motor pathways with repetition and movement. But that's one thing that we did see for the patient. As the results fast forward 3 weeks, our patient went from not being able to sit unsupported in her bed to being able to walk 15 feet with walker assistance, which is very awesome improvement, and we were really glad to see that. If I were to do this project again, there's nothing that I would really do differently. I would probably focus on a different topic just to kind of expand my horizon on therapy as a whole. But I do think I definitely learned a lot from being able to work with this therapist and this patient and perform evaluations. And it was definitely a very great experience. I want to give a huge shout out to Encompass Health for allowing me to intern with their company. They're a very great company, and they do a lot of good for people, and I really love that. I definitely one thing I did learn about myself is I really want to pursue occupational therapy. I think it's something that very best suits me, and working here at this site kind of really showed me that it's something that better suits me and my personality, and I really have fun doing it. So I definitely want to continue down that path. But yeah, a little bit about my poster. We did some methods of evaluation. Some of the biggest ones were let the patients tell their story, taking patient history, kind of getting an idea of what their home life is like and what obstacles they have to face at their home, whether it be, do they have stairs, do they have steps, do they have a ramp, how big is their car. We do the car transfer test. We have a car in our therapy gym that we use as a simulation to see how well patients get in and out of vehicles. We assess gait, we assess balance, muscular tone, and it's all of that comes into play when we develop, where the patient is and how best we are going to get them from point A to point B. That's a little bit about my project, and again, thank you, Encompass Health, and I really hope that you all learned something.